Thank you. There are still far too many people being sent home from nursing stations without receiving proper medical attention. This has to stop. Remote nursing stations in the north are viewed as Tylenol clinics. Far too often, many people are sent home without any care. Instead, they are sent home with painkillers as a standby prescription. All Manitobans deserve adequate access to health care. Can the Minister of Health tell us why the Aboriginal and Northern Health Office's budget was underspent by 57%?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, I thank the member for the question. It is an important question. She will know that the vast majority of nursing stations are operated and funded by the federal government. Certainly, we've had some concerns regarding the operation of those facilities. I've had the opportunity to speak to the two federal health ministers since I've been the provincial health minister about concerns around the staffing operations of the nursing stations. I'm sure the member has as well, Madam Speaker.
The Honourable Member for Kiiwetinoong on a supplementary question.
Thank you. I've seen far too many people getting diagnosed after it is way too late. We brought my mom down south where she was diagnosed with stage 4 non-Hodgkin's lymphoma. She bravely fought for a year. She had spent years going to the nursing station and being told that she was only going through menopause. The nurses and traveling doctors never sent her blood out as she had requested. Northern residents are still dying because of these cuts. While I respect the majority of nurses, they are not doctors. Why is the minister willing to spend tax dollars fighting the feds with ad campaigns but cannot stand up for those who need it most?
The Honourable Minister of Health, Seniors and Active Living.
Well, first of all, Madam Speaker, I appreciate the member opposite relaying a very personal story and a very tragic story. Madam Speaker, I'm sure it's not easier for her to relay that publicly, but I do appreciate her doing that. We have had many discussions regarding healthcare in the north with the federal government. We have been standing up clearly. That was, in fact, a big part of what the push was with the federal government to get real funding so that we could have better healthcare in the north. The vast majority of the nursing stations within the north are funded and operated by the federal government, so I don't disagree with her that there should be more support. I'm sure that she's also relaying those concerns to her federal colleagues, Madam Speaker.
The Honourable Member for Kiiwetinoong on a final supplementary.
We have to understand that northern residents are too scared to speak up. They're too scared to bite the hand that feeds them, especially when it comes to provincial health care. Nearly a year ago, I spoke with the health minister regarding the healthcare crisis in remote northern communities, yet I have seen no action from this government. Instead, we see funding cuts, inaction, and a refusal to meet with me or members of my communities. Will the minister commit to meeting with me and my leaders before the session resumes to discuss this ongoing crisis?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, while I greatly respect the member opposite and the issue that she raises, I will differ with her on the actions that this government has taken over the last year. In fact, the reason that we stood so strongly against the federal government's decision to reduce the escalator funding was largely in part because we knew that there needed to be more support in Northern Manitoba, Madam Speaker, and I know the Liberal Provincial Caucus didn't stand with us on that particular fight, but we will continue to speak to the federal government about the need to not reduce the percentage of funding for healthcare in Manitoba and the north, and I would hope that the member, given her question, which I think she said from the heart, would stand with us, Madam Speaker.